Our virtual town hall meeting. It is May 20th, 2020. I'd like to welcome the public that continues to participate in these very important sessions that we host on a weekly basis in our virtual city hall that has been shut down due to COVID-19. We still want to recognize the guests that co-host with us every week here at City Hall. So we have Bob Snyder, our health officer from the Health Department of Flagler County, here with us. Welcome.
Thank you, Mayor.
We have our city manager, Matt Morton, that's with us as well. And we have our fire chief, Jerry Forte.
Good afternoon, Mayor. Thank you for having me.
Thank you. And on the call today, we do have with us our continued special guest as well. We have Dr. Stephen Bickle, who's the medical director for the Flagler County Health Department. Welcome, Dr. Bickle.
Thank you. Happy to be here.
And we're also pleased to have our locally headquartered CEO of Diagnostic Laboratory performing some great work for us locally, but does a lot of contractual work around the country, subject matter expert on testing, in particular with COVID-19. So welcome, Tony Hoffman.
Hey, good afternoon. Thanks for having me.
And we're really excited to be joined today by our Emergency Management Director for Flagler County, Jonathan Lord, who manages different types of emergencies, but Jonathan, you are, I think would it say it's your first in your career that's also been part of managing a global pandemic?
Yes, definitely the first as a global pandemic. I've dealt with smaller things like Zika and H1N1, but they pale in comparison to this.
Well, you're doing a great job, so we really appreciate it. And a lot of good stakeholder relationships, and that's why we're doing these today. So we will be opening up with opening statements just as an update on not only COVID related, but we do have hurricane season upon us that I know Jonathan's going to give an update on sort of some of the things to do. I would ask our chief to chime in also about the COVID-19 and how that changes sort of the normal practice of preparation and how your teams are working collaboratively to ensure the safety for our residents if a hurricane indeed comes our way. We're hopeful that it's not going to happen, having 3 years of this. So, but that's the reality of the situation, and we have to address it, and we have to do it responsibly and safely. So, as always, we've got some great questions that have come in from the public, so our subject matter experts are here to respond. And so first and foremost, I'm going to ask our health department, if you will, to give the Flagler County Health Department update.
Thank you, Mayor. Be glad to. Hello, everyone in Palm Coast. Greetings this afternoon. Total positive cases in Flagler County is 169. Total deaths 4. To date, the Department of Health has received lab test results for 3,193 Flagler County residents. Of that number, 5% have tested positive and been quarantined for 14 days. The statewide goal was for all 67 counties in the state of Florida to test 2% of their population by the end of May. I'm happy to report, Mayor, that we reached that target earlier in the month. So we're interested in trends to monitor our progress here in Flagler County and Palm Coast. The recent 14-day trend indicates a 1.8% positive rate for new cases and emergency room visits for influenza-like illness and COVID-like illness downward. So that is very good, and we're glad to see that. The 3 Department of Health priorities still remain the same. Testing, first testing, which is happening at the Health Department, at the Daytona State College, community testing site, which Jonathan will speak about more, and other locations. The second objective, case investigation, interviews, and contact tracing, which we've been now doing for 5 weeks or longer. And third, assessment and testing of all residents and staff among the county's nursing home and long-term care facilities. So far, public health staff, trained volunteers, and the U.S. Public Health Service strike teams have completed testing for Sable Palms, Windsor of Palm Coast, Tuscan Gardens, Brookdale, Flagler Health and Rehab, and the Market Street Memory Care Facility. Grand Oaks Nursing Home and Princeton Village are next. 52 smaller adult homes and group homes for the developmentally disabled have also been tested. In total, 1,100 residents and staff will have been tested by the end of the day. So, why is this so important? It's because the two most vulnerable groups for COVID-19 are healthcare workers in these facilities and elderly with chronic and underlying conditions. So we are 70% there of reaching that goal. So those are the priorities for the Department of Health.
Thank you so much for that update, and again, your continued work. So Jonathan, I would ask at this time if you would please give an update from Flagler County Emergency Management. Again, all the work related to COVID, but also maybe speak about hurricane season upon us and some of the actions you're taking within your department.
Thank you, Mayor. So good afternoon. It's afternoon now. So as Bob talked about, we are continuing on with the COVID-19 testing through the Daytona State College community-based testing site. And that's in addition to testing going on at the health department's clinic off of 100 in Vanell. And many people's primary care physicians offer testing options, as well as our urgent care centers. So all of those different testing options available to the public are all appointment-based, so we always recommend that people call ahead to make an appointment. And if you're looking to make an appointment at the Daytona State College site, you can call our Emergency Operations Center at 313-4200. So in addition to the testing we have going on, a lot of our effort now is being spent on focusing on how do we safely and in phases reopen our community in sync with the governor's guidance, which itself is in sync with the federal government's guidance. So yesterday, Monday, we fully entered statewide what they call phase 1 of the governor's Reopen Florida plan. And that really added a few other counties that were excluded from the previous reopening, as well as added in a few different places like gyms in there as well. So we will continue this phased approach to reopening the state as a whole. The other big piece that we recently did yesterday is, as part of that phase 1 reopening process, the governor did say, in response to a question at a press conference when asked about how about vacation rentals, and he was questioned if hotels are open, why aren't vacation rentals open? Well, that reason is there was an executive order, and there still is in place, a governor's executive order forbidding vacation rentals. The governor did offer the option for local governments, counties specifically, to request an exclusion from that vacation rental restriction by submitting a safety plan. And that safety plan was submitted by Flagler County on behalf of the entire county and all of its municipalities up to the state of Florida yesterday. And we are waiting to hear back from the governor's Department of Business and Professional Regulations, who oversees vacation rentals as well as a host of other businesses, whether or not those vacation rentals within our community can be reopened. So we are waiting to hear back from that. We would expect to hear one way or another today or tomorrow based on the timeline that seems to be taking them to get back. Some other counties we are aware got a tentative, a no, but if you fill out this missing piece, it'll become a yes. So we don't know what they will tell us, but as soon as we do, we will message that with our municipalities and we'll message that with the public. And we know there's been a lot of questions about short-term vacation rentals coming open. We've also had, and just to help clarify that, just because the state gives Flagler County an exemption, if and when it does not mean that, let's say a vacation rental, many of them are in condo complexes, it doesn't mean that those condo associations can't have stricter requirements. That's entirely on that private entity as to the requirements within that association if they want to have additional requirements. So we continue also to look forward to what it means to open up additional government services. And again, this applies to municipalities as well as the county. And we continue to partner with municipalities such as Palm Coast to provide guidance and information as we receive it on how to safely reopen and allow additional services. So one of the things we've been spending a lot of time in the last couple of days on is understanding further reopenings of ball fields and playgrounds in particular. And at this point in time, the primary national ball associations, and that includes baseball, amateur baseball, amateur softball, lacrosse, soccer, all of those groups at the national and state level are still not advising the resumption of play on ball fields. And we don't know when that will change on their behalf. But we are kind of taking the guidance from them as they are the experts in those kinds of athletics. Additionally, with playgrounds, there is a National Playground Association as well as the CDC that are both saying playgrounds should not be open at this point in time. So we are not looking to change any of that guidance until we see those lead national groups change their particular guidance on those things. As the mayor mentioned, we are looking forward towards hurricane season, but not forward in a positive way necessarily or a negative way, but just looking forward towards hurricane season and trying to understand what the differences in our world will be for hurricane evacuations. We're very cognizant that there may be some hesitation with residents who live in evacuation zones seeking public shelter. Our primary recommendation is all those residents that live in evacuation zones is to, one, know that you're in an evacuation zone. First all, I know that information is available on the city's website as well as the county's website, as well as in our joint disaster preparedness guide that we should make publicly available in most government facilities. And we can always mail them as well if someone wants one. So once understanding if you're in an evacuation zone, and if you are, and that zone is ordered to evacuate, please do not risk your life and stay behind. If that storm surge comes in, which is what determines our evacuation zones, storm surge is extremely deadly. So we ask that if you are ordered to still evacuate. Now is the time to consider where you may go. If you're concerned about or don't want to take advantage of congregate sheltering in our schools, then we ask that you take the time now to make plans to shelter with friends, family, or even stay in a hotel as long as it is outside of the evacuation zone. And that could be as simple as, in most areas, just crossing over 95, and you're outside of almost all of our evacuation zones. So when it comes to congregate sheltering or shared sheltering in our schools, again, we're still always going to offer that service, and we have a great partnership with our cities and our school district to help us staff and operate those. And we are looking at increasing space allocated for each evacuee, as well as having mask requirements for those that come with masks and providing masks to those that don't have access to a mask within the shelter to help minimize the spread of COVID-19 should that occur in the evacuee population. But again, we want to put as many safeguards in place as possible. Please rest assured that we are working through that. And for those that have the means and ability to do so, again, now is the time to prepare for hurricane season and look at alternate evacuation plans and not rely on public shelters if you have those means. But again, if your area is told to evacuate, please don't ignore those orders. Please heed those orders and seek appropriate shelter. And then just last but not least on hurricane season, starting next week on May 29th is the statewide disaster sales tax holiday. So as people are building their hurricane disaster kits, that we ask, that's a great time that people should take advantage of saving sales tax and shop in our local stores to build your hurricane supply kits.
Thank you so much, Jonathan, for that great update. And again, I mean, juggling many different balls right now as our first responders and emergency management teams often have to do in our communities to ensure the safety of others. So, Chief, I would ask that you add anything additional to that.
I'd like to thank Jonathan for all the work that he's been doing for the last 68 days straight in a row. John, I know you've been putting a lot of time in. It's been recognized. You're doing a great job, and we appreciate your guidance and all you're doing. One of the aspects that we have to consider in Palm Coast is that when we do offer an evacuation notice, that the entire city doesn't evacuate, just the designated areas, B, C, D, that are in Palm Coast. And if anybody doesn't know where they live, they can check the disaster guide to make sure that they know where they are, or if they have a street sign that they are pulling up to that has a stop sign, it should be noted at their stop sign if they are actually in one of our zones in Palm Coast. Evacuation Zone A is all on beach side, so that usually those are the first to be evacuated during a disaster, such as a hurricane. But if you're living in the city, not to be confused with living in the Evacuation Zone B and what we would call the B section or Indian Trails. Your streets would be identified with a street sign that would say exactly what zone you live in, if in fact you are in one of those zones. As part of one of our extra duties is what we're doing is we're at that sweet spot in between wildfire season and hurricane season, and our drought index is climbing. It's getting to a point where we are considering additional staff as we get to today's drought index is 425. The relative humidity is a little bit low today, but it's our Captain Holmes is our coordinator for wildfire, and he determines if we need to upstaff more people for smaller vehicles for rapid response. I would say in the next 10 to 15 days, we're going to be in a position where we have to upstaff more, and that's just an internal policy of what we normally take on. With that being said, is you can't have a wildfire season and a tropical season at the same time, because usually the tropical season drowns out your wildfires. But we're not there yet. We're still rising on our drought index, and we're still considering one operation while preparing for the next one. As Jonathan did mention, everybody has to be prepared, and municipalities and county agencies that respond to these things also have to be prepared. So during wildfire seasons, we're preparing trucks for brush fires and wildfire preparations. In a very short time, we're going to be preparing our trucks for the hurricane seasons and chainsaw work and things like that. So we have a lot of work to do aside from normal operations and the COVID response. As far as citywide, we've taken some strides with developing our long-term plan for opening up the city. We had a high-altitude view. Captain Asconi has been working the last 2 weeks on developing one-on-one plans with the departments. Those departments are now getting a little bit more closer to what it's going to look like in which phase as they open up. The critical part is, do we need to bring back everybody in one wave, which probably is not the best solution. What we want to do is to find out who the most optimal people are and bring them back slowly and start integrating our cleanliness practices and our hygiene practices, so that as we start to open up to a full phase in phase 2, we have the staff that's going to be on hand and the new behaviors are in place so that it's customary. We still have some more planning to do on opening up the city government itself, but it's very exciting to see that other things are starting to open up and the trends are still focusing down. That is a very positive sign for us to open up the city more.
So, I'd like to stress the point. I was listening to the county commission meeting the other night, and I know our clerk of court, Tom Bexley, had presented to the commission on a financial matter. However, he did relay that on June 1st, the Judicial Center in Flagler County would be reopening with certain requirements attached to that, safety requirements. One of them is all of his employees will be wearing masks throughout the day. That is a decision that the clerk of court made for the protection of his employees as well, with the guidance of our health professionals. And he is requiring that everyone that does enter the Judicial Center wear a mask as well, or they will not be allowed access. So, we're talking a lot about, different responses, but I always say it's our first responders also that we have to keep healthy, because they are required to respond to everyday calls, as well as, sources of emergencies that could hit our community, that they have to be adequately resourced in an effort to keep our residents safe. So, Matt, I would just quickly ask that you just talk about from the city, again, perspective. We are aligning a lot with the governor's recommendations. Our phased approach has been consistent with that, as well as the federal guidelines. So we're pleased we're working in concert with that. But specific to Palm Coast, we have over 90,000 residents that we are responsible for in our community. Very high-risk population that has put us in a position of making decisions on their safety, on behalf of their safety as well. And so we always recognize those moments that our responsibility lies not only with this pandemic, but in other ways. So it's very comprehensive in nature. These conversations are happening every single day, at every hour, as we get more information, and our city manager sort of tries to manage a lot of the sources of information, and then works with our response team in an effort to make sure we're managing this. So did you want to add anything? Because I also wanted to ask Tony Offman to sort of give us a testing update, but I thought from the city's perspective, if you can just briefly touch on any points.
Sure, thank you, Mayor. Great questions. And yes, the conversations happen daily, they happen hourly. We have great working groups and great partnerships in our EOC calls every morning. And to your point, sifting through every day the needs of our community that we're very aware of, and trying to connect resources and information, but also being very strategic and thoughtful in the way we're proceeding. Moving to open as appropriate, making sure we have our best practices and guidelines, making sure we can, again, support our businesses, support our residents, support our community members in doing this. So it continues to be a process. It's not stalled a process by any means, and I think people will know from following these town halls and from following the news, there are changes every day. We're, incorporating those and reacting to those. There is no, effort to stall a reopening or to drag it out beyond, again, following, best guidance, best information we have, best available science we have, constant coordination with our EMS and first responders, keeping into account that we are 68 days of EOC opening. This has been a marathon that we have, across the state. We're experiencing wildfires at significant levels, and our KBBI, our fire index, is very high here. And the fact we had our first named tropical storm, thankfully, pass us, Arthur, but that we were in hurricane season. So again, this is when people ask why is it taking so long in some aspects, again, responding to the best information, monitoring that information to make sure we're responding and continue to move appropriately. And then a lot of this, what we're dealing with right now, is resource allocation. It really is understanding that we're in this opportunity to potentially have 3 major incidents or events happen at once: a fire, tropical storm, or hurricane, and this continued COVID-19 global pandemic. And so, we keep those 3 things in our minds as we make responsible economic decisions, as we make logistic decisions, and pragmatic day-to-day decisions, again, to help our community, serve our community, and keep our responders, our personnel, our medical staff, and our residents safe in those appropriate ways.
So, Tony, if you could just give a sort of a brief update on testing. We still continue to get a lot of good testing questions. We know there's ongoing testing, and then a little bit, about the testing world, globally, because I know you're actively a part of this process.
Sure. So for Diagnostic Solutions Lab, we're still maintaining the same contracts. We haven't taken on any further contracts in order to keep our turnaround time where it is, with the exception, and I wasn't sure if I mentioned last week, that we are doing the COVID testing prior to surgery at 6 of the Advent Health locations in the state. And that's because we can turn those samples around relatively quickly. In general, from our statistics, we still see a drop in positive rate. We're still doing about the same volume of testing, but the numbers of positive tests coming through are much lower. As we were talking last week, we didn't have an exact, I couldn't tell you if it was sustained or not. As places are opening up, a lot of people ask the question, hey, is the positive rate going up? For us, it is not currently, but just to be clear, we don't do all the drive-throughs, a lot of drive-throughs, which would have a lot more patients or, the public coming in for testing. But at the hospitals, that rate is still much, much lower than it was 3 and 4 weeks ago. So that's a really positive sign. Why is still up in question. Likely, the moist, humid, warm air in Georgia and Florida might be contributing to that. But I'll kind of reserve comment on why it might be going down, other than say it is going down, which is a great thing. So, because we do have the concern that as we open up, we might start to see the positive rate climb up again, and it's quite possible that that could happen. But we'll keep track of it, at least through all of the locations and institutions that we work with. But that's a positive sign. And we are still running, we run samples for the Department of Health here in Flagler County, and several other counties in Georgia. So we do see other populations outside of the hospitals. And again, that rate is still declining on the COVID-19 swab testing.
Thank you so much, and thank you again for your continued work. So, you know, I'm going to switch a little bit of the conversation to masks because we do have Dr. Bickle here as well. Dr. DeGennaro had to be called out in an emergency, so unfortunately he was not able to come on today, but we've also posed these questions to him as well, as a couple were directed towards last week's discussion. And so in regards to that, Dr. Bickle, there are several sort of maskly to you as far as how does a lay person wishing to protect themselves obtain an N95 mask when I myself, being a registered nurse, has to mine ration out of cleaned many times before I'm issued a new one? Am I taking care of patients in a hospital? Seems to me all spare N95 needs to go to frontline workers. That's one of the questions. These are multifaceted, so I'm just going to pose them, and then you can really just talk about masks from different perspectives. I read where a doctor said that SARS and MERS viruses went completely away after 2 years. He predicts the COVID-19 virus will also disappear after 2 years. I'd appreciate your comments on this prediction, again, and maybe some of the practices related to that, and about why we're not, you know, since last week's subject matter recommended it, and since it's a growing trend, mask wearing a requirement rather than just a recommendation, and since a significant number of our residents are not complying, why shouldn't we enact a public mask wearing mandate in Palm Coast, especially as appears essential businesses where social distancing is difficult? So a lot of those questions combined, Dr. Bickle, but I know you do a tremendous amount of research, reading, and contact around the world with the different trends and dialogue and discussion. So if you can address those, that would be helpful.
Okay, let me first start with the N95 mask. Lay people do not need N95 masks. I mean, maybe if you're quarantined in a home with somebody, you're taking care of them, they've got a, you know, they have it, that would be an indication. Other than that, it's for healthcare workers, but we have a free enterprise system. If somebody can get them through alternate sources, you know, there's no way to stop that. There's a lot of effort, both government-wide, business-wise, volunteer-wise, has been directed to getting N95 masks to the people who need it most. I have total sympathy with this person. We need to do everything we can to make sure our care workers are protected. And, you know, the fact that somebody can get an N95 on their own, I think still we have to do everything we can to get these masks to the people who really need them. And people should just know, lay people, they do not need N95 masks. Masks are generally not protective for you. They're protective for somebody you might give this to if you were asymptomatic and had it. So people should understand that. It's really overkill. The second question, SARS and MERS are totally different viruses. I mean, the epidemiology is just totally different. The transmission rate is different. It doesn't transmit asymptomatically. It's after people are symptomatic. It kills people, so it doesn't spread that well, but they're very lethal. They're just different viruses. Every virus has its own sort of patterns based on its characteristics. And so this person who said it's going to be gone in 2 years, I hope he's right. There's no real reason to think it will. It could very well mutate and then evolve into one of the flu viruses or cold viruses that we have every year in a sort of diminished state. That often happens to these viruses. We're hoping, you know, that there'll be some herd immunity. That's going to take a fair amount of time, much longer than people realize. But, you know, color me skeptical that it's going to be gone in 2 years. And then the question about promoting mask use. Everybody on the city and county levels, any official we've talked to is promoting this. We're just trying to figure out, I think, the best way to do it. We don't, people value their freedoms. We're trying to encourage people to do this as a civic responsibility. Mayor, I guess you could talk to, what thought process you've been going through in that. There's no, with this, I don't think we want to be giving tickets to people who aren't wearing masks, but that's not for me to say. The other thing people should know is people, I saw one of these questions, maybe it's in a separate section, but about, do you need to wear masks outside? There's a spectrum of risk. The highest risk is 15 minutes or more exposure to somebody who has it within 6 feet. And that's what they use for the contact tracing criteria for who needs to be traced. Beyond that, there's no limit where there's no risk. If you stay in your house, don't let anybody in, don't accept any packages, then there's no risk. But anything beyond that, there's a little risk, and we're trying to minimize the risk or maximize the risk outside. They've actually done studies showing, like, if you're in the slipstream of somebody who's riding a bicycle, there's virus, there's some droplets that could go up back to 50 feet or 30 feet at least. And, there's been a lot of studies. So there's some studies showing coughing can spread virus out even 15, 20 feet beyond the 6. But for the most part, 6 is a good guideline. Outdoor, there's been 2 clearly documented cases of this spread outdoors. It's mainly indoors, it's mainly household, it's also retail, it's also workplace. Ventilation systems matter. There's our debating, how we balance this, how we control this. And I hope I didn't run on too long, but I think I covered everything.
Yeah, no, that was perfect. And again, it really is an important topic. And it's something we do discuss and have a dialogue and rely on our professional healthcare advisors to help guide us that. So I think there's going to be something that does come out from the city as far as those guidelines and recommendations. We are trying to finalize that as a way and an effort, again, to promote that civic responsibility, not requiring, not ticketing, however, encouraging, when necessary, and how and why, with the data associated with it, that I think is an important component of that. Again, we're trying to do this to protect others in our communities. So let's skip a little bit back now to testing, because, and then we'll talk a little bit more about the reopening as a way to also have all of our subject matter experts given the time wisely here today for our residents to understand the significance of what we're going through. There was a lot of discussion late last week about the 25,000 tests that had been given from Advent Health. Or administered from Advent Health. I want to make it very clear that Diagnostic Solution, Tony Hoffman, that was not the laboratory that had any connection to that dialogue or discussion. But Bob, I'm going to pose this question to you because I think it's an important one. In particular, how it's impacted Flagler County and testing overall, because I know Jonathan, and your team and a lot of volunteers that really have put a lot of time in to do the drive-through testing has been something that you have really felt has been critical with the testing directives that you have been given. So if you can really speak to what your understanding is, the impact of the Flagler County tests themselves, and how the health department is trying to also get a better understanding of this.
I'd be glad to, Mayor. First want to say that, I'm not a spokesperson for Advent Health, but I am able to share some information that they've made public. So this involved 25,000 folks who got tested at 3 to 4 Central Florida counties, including Flagler, from April 29th through May the 8th, so it was 8 working days of folks whose lab specimens were sent to the lab in question in Texas, and it dawned on us that after seeing that test results were not coming through either electronically to the Department of Health in Tallahassee or to patients themselves, that generated a lot of phone calls by patients and us wondering where are the test results. And I was able to confirm that, we don't have any evidence or data either locally or at the Bureau of Epidemiology that the test results were received, so we were waiting for them along with the patients as well. So I'm able to quote a letter that was sent to physicians that are associated with Advent Health in these counties impacted. And I'm not going to reference the entire letter, but just portions of it that I think folks who did get tested would like to know. And it impacted 1,017 test results here of residents in Flagler County in that 8-day period. Advent Health, everyone, is a very valuable partner, healthcare provider, community partner, and we're just so fortunate, truly, to have a wonderful hospital and staff in our community. They regarded this situation as very unfortunate. I know that they feel awful about it, and in the letter that they sent to physicians, they do state that, and they also state that we've terminated our contract with the lab. We've also prepared letters to go directly to those impacted, which offers complimentary tests to those who are symptomatic. So of the 1,017 folks that got tested in that time period, you can expect a letter from Advent Health to direct you accordingly and with an offer to retest. And just finally, I'll say that towards the end of the letter, it basically says that there'll be 3 important communications regarding this issue. Again, if you had a test performed and your personal result was considered unreliable, you will hear from us. You will receive a letter or a phone call. And then as an ordering provider, you may receive communication regarding your patient's tests. So I know that there's a commitment by Advent Health to make it right. But especially anyone who is asymptomatic and feels like they've been exposed or at high risk, we have community testing still happening at the Daytona State College Palm Coast campus. Right now, Quest is the lab that is processing the specimens as we speak. That started on Tuesday. Diagnostic Solutions, where we get wonderful turnaround results from, they did the testing all last week and this past Monday. So we feel very good about those labs with quick turnaround results and reporting. So do expect to hear from Advent Health. And again, especially if you're symptomatic, definitely call the county call center so that we can get you an appointment to be tested at the Palm Coast campus site.
Thank you.
I hope that helps, Mayor.
It does. Thank you very much. We're going to stick to a few more questions about testing. So I would either pose these questions to either you, Bob, or you can pose those to either Dr. Bickle or Tony Hoffman. So I'm going to read the questions, frankly, and then, again, Jonathan Lord, feel free to jump in as well. I know you've been part of this process. So I'm going to read those first, and then, Bob, if you want to put them to the speakers, that would be helpful to manage this. So it seems like there is more testing going on in Orange County than here in Flagler County. Plus, you can go get tested regardless if you feel you've had the virus or not. Why don't we have that here in Flagler County? That's the first question. Why has it taken the county weeks to address confusing and far too lengthy testing processes? What does the restrictions look like for Memorial Day weekend? I'm not sure if that's applicable to testing or not, but maybe that's something our chief or Jonathan can speak to. Why about the 14 days or more for COVID tests at Daytona State College? And then why are we opening anything over 900, then over 400 new cases 2 days this week? So I think clarification of that might be important. And then about the length of feedback, and then how many actual people have been tested in Flagler County, as well. The dashboard itself, the Florida dashboard, does not necessarily give how many people are tested by county, only noticed only by the total state. And then the final one question about testing is when we will have access to accurate antibody tests.
Okay, let me start with the antibody testing. Right now, antibody testing kits have been shipped out to mainly hospital systems and universities right now in the state of Florida. So it is not for broad distribution yet in the community testing site setting. The reason for that is there still is only a very small number of labs, I think 4 to 5 nationally, that have been approved by the FDA for passing the specificity and sensitivity rate requirements and standards for a valid, reliable antibody test. So that's the answer to that question. Secondly, and Jonathan Lord will punt to you here in a second, with respect to total Flagler County residents that have been tested, we've received to date 3,193 electronically reported lab test results for Flagler County residents since the beginning of this pandemic here locally. So our testing continues to increase in a considerable way. And we're way beyond the 2% goal that the Surgeon General gave each of the counties in the state of Florida. Testing is still continuing 3 days a week, and the hope is to do that through the month of June. With respect to the labs that we used, Quest right now has told us that we'll get lab results back within 4 to 5 days. And so this is a large lab company, and we expect them to deliver on that promise. Diagnostic Solutions, who we use, those lab test results come back in 2 to 3 days. So that is excellent. So I don't think we're going to have a problem going forward with respect to quick turnaround of lab test results. But Jonathan, you agree we got a real strong, robust lab testing operation happening out at the college?
Yes, we do. And so so you mentioned total numbers countywide, and that's an amalgamation of multiple sites submitting results back to the health department. Specific to the Daytona State College community testing site, we've actually, as of last night, we had tested 1,674 people. So a large portion of the countywide numbers are coming from that site. But I do agree with you, Bob, that when we luckily have direct control of the lab through our contract with Diagnostic Solutions, which is an amazing company to work with, and we still are holding onto that contract should we need to continue to use them, as well as our shift to Quest with the State Division of Emergency Management picking up the cost of the labs. As of earlier this week, I very much have faith that we will get good turnaround times. And again, I don't want to commit to any kind of turnaround times, but definitely less than a week with the Quest solution. And they've been doing it longer than since we were asking for their assistance. So they've been repeatedly shown that they can deliver what they are promising.
And a very important statement to make is the following. When we began testing in the beginning, we were asking folks who have the clinical symptoms to please call the call center and make an appointment for testing. Now, what we're saying is, okay, we're looking for you if you have one of 9 symptoms that have been identified for COVID-19. And oh, by the way, if you feel like you've been exposed, you're at risk, or you're just concerned and you're anxious and you want to get tested, we will test you. So, Jonathan, the restrictions have really loosened big time with respect to testing. Can you just share with everyone, Jonathan, what the number is to call for the call center to get an appointment to get tested?
Yeah, so for the Daytona State College site, it is 386-313-4200. And then, Bob, I don't want to misquote the health department's number. I'll let you share that one.
Okay, so you want to call the health department and at 386-437-7500 to call the health department to get tested. We're testing about 15 to 20 patients a day at the health department, plus the urgent care centers in town are testing. AZA Health on the Parkway is testing. The Centric Care facility, so it's more than just us at the health department and those at the Daytona State College site through the county.
Fantastic. I'm going to pose this question again to probably Dr. Bickle. This is not, the city of Palm Coast does not govern the school district. The Department of Education is through the state of Florida. However, there have been dialogue and discussions on reopening of schools and when that's going to occur. But it pertains to no cure of the virus. So again, when we talk about reopening strategies, there's a lot of data that goes into that. There's a lot of benchmarking that goes into that, and that is really for the safety of others. But I'm not sure the direction of what the schools are actually doing. However, this question came forward about how can you speak about opening schools back in August with students and staff if there's no cure for the virus. And so, again, Dr. Bickle and Bob, I think you could talk about mitigation strategies, and I think that's going to be the important aspect of this. When we do reopen, and we are reopening, actually, there's a lot that's reopened, there's mitigation strategies that are put forth, and that goes back to the virus and the spread of virus itself. And that hasn't necessarily changed because it still spreads the same way it spread initially. And so, Dr. Bickle, if you can just really talk about the lack of a cure, again, for the virus, and any type of vaccine discussion might be helpful for the listeners. And then I'm going to pivot to more of the reopening questions.
Sure. This idea that we can't wait for a cure, and we can't shut our economy down and then, for 3 months, 6 months, 9 months, we'll all starve to death and go crazy. So it's a question of balancing risk and the impact of the various strategies, how effective they are in controlling this, and then what's cost to society. So this is something that that you guys in the city are juggling daily. It's a very tricky area. In terms of risk to children, there are some rare cases of these serious immunological complications from COVID. But for the most part, children just skate through this illness. They can infect their parents, they can infect their grandparents, that's an issue. But also, parents can't go to work if they have to do daycare. So it's a lot of ramifications here. There have been various ways of looking at this and what things you can do to control the spread that aren't as intrusive as shutting down the schools. So what we're hoping, and I think the general strategy that, I know we've all discussed internally, but the public should know about, is that there are a lot of little things you can do to chip away at the contagiousness of this as you're allowing people to go back to their normal lives. And there's no question that as social or as mobility increases in a community, they've looked at this with Google and Apple mobility apps and stuff, that there's about a 10-day lag and the case counts go up uniformly everywhere. How much they go up depends. But then you have all these other things that you put in place, like more rigorous contact tracing, more widely available testing, everybody wearing masks, looking at the higher contact areas and maybe taking even more aggressive measures. So you're trying to do everything you can to balance this out and let people resume their lives. And this school thing is part of this, but we can't wait for a cure. It may not come. We don't know when it'll come. We can't afford to, shut down everything until then. Shutdown has always been a policy to get things under control and then to use that to transition to these other measures. And once the case counts are low enough, then these other measures are much more effective.
Thank you for that. Great clarification and response. As far as the reopening, so Matt, a response comprehensively, I think that would be helpful. And I would just ask both of you to bounce these answers off of each other as well. Again, our golf course, we have one public golf course. We have a few private golf courses as well. But if you can speak to the reopening strategy of our golf course, our tennis center, pickleball, those sorts of recreational amenities that opened up early this week, and some of the mitigation strategies and restrictions around that and why. Why is the Palm Coast Aquatic Center not open this year? Again, would someone please explain about the summer programs and what decision led to the continual closing? About Indian Trail Sports Complex being closed, could it be used for walking? And then playgrounds. I get a lot of questions around playgrounds. Our children, you know, are at minimal risk, right? But talk about maybe that strategy on why we continue to keep our playgrounds closed. I know Jonathan referenced it as far as an association. And then there is a question I'll pose to Jonathan after Matt and our chief respond about the DMV tax office. That is a county operation. And then the individual just talked about renew my driver's license. I can't do it online because I have to bring certain items of information and purpose for this one. I've not kept up as far as the DMV operations and what their decision for reopening strategy will be. And then I do want you know, the fireworks, Flagler Beach and the City of Palm Coast. City of Palm Coast has an annual fireworks tradition in our town center, our downtown. We have an average around 25,000 residents that have attended it the last couple of years. The city has made the decision to forego fireworks for this year. Decision made, again, I'll ask both of you on why that decision was made. And likewise, Flagler Beach and many other communities have made that decision. And I think it's important for the public to understand why we make these decisions, when we make these decisions, who makes these decisions, frankly, and who's involved in those decision-makings process that allows for the continual safety of our community.
Jerry, how about Chief, how just from a management budget perspective and public safety and reopening strategy? So I'll attack it from one angle, Mayor, thank you. So, you know, as Dr. Bickle always has nuggets of wisdom for us, one of the things he said is this is acceptable levels of risk, and this is kind of what we're balancing. And so when we talk about the swim facility, when we talk about Indian Trails Park, when we talk about, you know, why playgrounds aren't opening, I'll use the pool as a specific example. So the pool is of itself its own public safety enterprise in the best of times, and we are faced right now with some serious resource challenge constraints. So part of the decisions that are being made, whether it be fireworks, you know, let me try to get organized so I don't ramble too much. The fireworks decision, it's not a decision we make a day before or 10 days before, let's do a fireworks celebration. These are resource-intensive planning exercises that don't just take an initial capital cost of, you know, on average, I think the $25,000 for the City of Palm Coast for the fireworks, but an enormous effort of staff. We have hundreds of hours of staffing, not just from EMS and responders, but public works crews. We call in overtime from, you know, different various levels of the city to facilitate and pull off to what our residents is a phenomenally seamless event. Again, right now, facing three challenges of a hurricane season, a wildfire season, and a marathon of a global pandemic, you know, this was as much a resource-based decision as anything. This was not a fear decision from a management perspective. It was, we simply, at this moment in time, I cannot credibly dedicate, I don't have the resources to dedicate, to put on planning and executing where everyone can come, enjoy, be safe, be distanced. So Jerry talked about the health aspects, you know, that level of a community engagement. It's the same thing with the pool. The pool is a public safety enterprise. Lifeguards are trained first and foremost for public safety. They're trained to keep you safe in the water. We couldn't create those distractions of temperature stations. We couldn't figure out how to solve that problem. Temperature stations, check-in, check-out stations. We have two, you know, very disparate groups of people who use the pool. We have our population who needs that for low-impact exercise. I understand that, and we sympathize with that. And then we have a lot of young children. And so typically those two interactions of groups have been unproblematic. How do we get those two groups together and not let our young, jeopardize our more infirmed or at-risk population? So again, I'm talking from this resource allocation. The preliminary number I have today, which I haven't shared with council, from the best forecast we have, is general fund is looking to take an $860,000 reduction for the second half of this year. That's tremendous. And so a lot of these decisions, not only do they have this public safety component, which Jerry's going to talk about, but we really have a responsibility at this moment to be resource allocation focused, provide our essential services, continue to maintain the amenities we have to those levels, and then safeguard public assets. And so, transitioning to why we didn't open Indian trails for walking. So we have hundreds of miles of paths and bike trails. They're phenomenal. We, on a resource allocation, said, how can we open those, monitor, and maintain? What we found early on with the parks, and I don't want to lump all the bad apples in the barrel, but with unmonitored parks and disparate hours that we couldn't appropriately resource staffing for, we were finding vandalism. We were finding conditions that need us to solve on a daily basis. If there's obstacles, we should be removing those, just like we collect garbage, just like we collect, fill holes in turf, or again, resource allocation. We're focused on those facilities that are open, which are a broad number right now in the city. To your point, Mayor, golf is open, tennis is open, pickleball nets are out. Open space parks are open, trails are open, bike paths are open. We can effectively resource allocate those, so when you go out, you should have a great experience, a safe experience, and an experience that we can continue to deliver the expected and frankly required level of service that we're responsible for providing. So again, I sense the frustration in that question about, why, and again, from my perspective, being very focused right now on what resources we have, how we allocate them now, and looking into the next 6 months of unknown budget consequences. We've taken a lot of measures. I'm sure the public's aware at City Hall. We've frozen hiring, frozen any kind of cost, staffing cost increases. There's no pay raises. There's no COLAs. There's no, very sensitive to this economic situation, and we are trying to manage the resources we have to endure this marathon and get out effectively while maintaining quality of life and maintaining the condition of the assets that this community owns.
That was well said, Mr. Morton, and just to give you the perspective of the operations, we would love to open everything up, but it's a matter of hygiene and sanitation when you start getting into that aspect. If you get into a park setting, as nice as the park is, people touch a lot of things in a park that can't be sanitized on a regular basis. So by the time somebody gets done using something, and you have to let it rest for 15 to 20 minutes, and somebody else uses it, there's not that quality control that's put in place for the safety of the users. I was pretty happy about how they did the opening of the golf and the tennis area. We did a walkthrough last week with Lauren Johnston and her staff, and they methodically allowed the opening to take place over a period of time, that when somebody pulls up with the golf cart, no one touches the golf bag. It goes into a single cart. The cart is driven by one person. When they get done playing and get done what they're doing, it has to go in a certain way, and it gets disinfected. It is a controlled environment that everything is done methodically, responsibly, and thought through. And to address the fireworks, this is not the first time we've canceled fireworks. We've had the 98 fires where we canceled the fireworks because of the disaster. We've had droughts in the past several years that we've canceled fireworks because of it was too dangerous. Let me just touch on the process of doing a fireworks display. First, you have to put a plan together, and it has to be organized. It has to identify how many elevated shells go up, the size, the diameter, and the extent of how long it's going to be in the air, and the fallout zone in which it's supposed to occur. So there's strategic planning that has to be analyzed before the permit is even issued. Once the issuance of the permit is done, then we have an inspection on the day of, both at the time that they arrive, so that we do a count of what they have and they're not overloaded with what they're supposed to supply, and they have to make sure that the firing mechanisms are in place and the igniters are what they're supposed to be. Then there's a separating the crowd from where the distance is supposed to be, and it's 75 feet per inch for the aerial devices. if anybody is deciding that if we're going to have no fireworks display and they're going to run their own, that's an extremely irresponsible action to take, and it is recommended that you don't. First of all, it's against the law. You have to have a permit. You have to be a licensed supplier of fireworks in order to have a display. The things that you find at the local box stores that you can buy are ground displays. They're small things you place on the ground. Those are legally purchasable in the state. They're not aerial. Anything that goes up in the air has to be done in a certain way through a governing body. Any other way is dangerous and irresponsible if you think you're going to go out and do something like that. So when we look at these circumstances, these were touched on by Dr. Bickle earlier. These are unusual circumstances, and they're going to be different for a very long time, if not permanent. So when we start looking at, we're going to have a fireworks display, and I'm looking at a fire danger right now of 425 today, and it's going to grow. A month and a half ago, we were canceling a lot of things because the drought index was this high. We are there. We are at that point where we need to start considering canceling a lot of things that have to do with fire danger. So I don't have a problem pulling the plug on something if it's going to be a detriment to the community or an individual, if that's the case.
Yeah, and I think, you know, we're certainly running out of time, or have run out of time. Just to close that loop again, you know, we still have to remain diligent about social distancing, continuing to practice, obviously, the washing of hands, the wearing of masks when applicable. So 25,000 individuals in a downtown center in the middle of a global pandemic is nearly impossible to manage. Resources, one thing; safety, absolutely, in the middle of a drought index that's increasing and you know, continuing to climb every single day. But we cannot ignore the fact that we are still having to mitigate the spread of this disease or virus in our community. And in an effort to do that, we have to maintain social distancing. That's got to be something that's not ignored at any level, at any given time, under any condition. And so ongoing, and we have them all the time.
And just a quick point, I know we're running out of time, but, you know, back to that resource allocation thing, which we mentioned, you know, those teams, this is internally is a team of 20, 25 people. Countywide, we probably have 50 people collaborating on our community celebrations. Those people every day are on EOC calls, they're on partnership calls, they're on health calls. So, again, we're not ignoring it. We're not trying to, you know, but the resources simply aren't there right now to deliver these things the way they should be for our community.
And Jonathan, I don't know if you want to add anything at the end, Jonathan.
Yeah, I'm actually about to run out the door, but on your question about the tax collector and
Yes.
driver's licenses, the tax collector office is open with modified services, including driver's license services. We recommend people call 313-4160 to find out how they can access those services. The office in Flagler Beach is open 8:30 to 7. The walk-up window at the main government services building is also open for certain services, but for folks to call 313-4160 and to access almost every driver's license type service.
Thank you so much, Jonathan. And thanks for everyone participating on the call today. Thanks for everyone tuning in today. To our co-hosts weekly, we are going to continue our virtual town halls in an effort to communicate, update, inform, and answer your questions that are important to everybody in this community. So stay safe, and we will all get through this together.